Welcome to this explainer. We are jumping right into a fascinating microscopic detective story happening right inside our own blood vessels. Today, we're investigating the absolute most common anemia in the world, iron deficiency. Using the highly respected text Hofbrand's Essential Hematology, we're going to break down exactly how this condition stealthily develops, how it literally breaks your body's energy factories, and how modern medicine actually tracks it down.
Just to wrap our heads around the scale of this issue, a staggering 500 million people worldwide are currently affected by this condition. That is 500 million people operating on less than a full tank of oxygen carrying capacity. It makes iron deficiency a massive global health challenge that completely transcends borders, affecting people in both developing and developed nations alike.
But looking at a massive number like that, it really begs the question, why is the world so tired? Iron is literally one of the most abundant elements in the Earth's crust. It's everywhere. Yet somehow, the human body has a remarkably limited capacity to actually absorb it from our diets. Add to that the fact that we have absolutely no physiological mechanism for eliminating excess iron, and you realize our internal iron balance is incredibly fragile.
So let's get into spotting the hidden signs. Because the human body is excellent at compensating for slow changes, the initial signs of this deficiency are almost entirely invisible.
Long before you might even realize you're officially anemic, you might experience profound, unexplained fatigue and even depression. It's so often just written off as being stressed, right? But as the deficiency progresses, these general symptoms really start to escalate. You'll start seeing shortness of breath when you exert yourself, frequent headaches, and once your blood's hemoglobin concentration drops below 90 grams per liter, you'll see a noticeable pallor, a pale color, in mucous membranes like the inside of your lower eyelids or your nail beds.
And this perfectly illustrates one of the more bizarre, yet highly specific physical signs of iron deficiency. This is a condition called Koilonychia. Notice how the fingernails have become brittle, ridged, and physically caved in to look like little spoons. It's a striking visual consequence of the tissues simply not having the iron they desperately need to build normal, strong cellular structures.
And the weirdness doesn't stop there. Another fascinating physical manifestation happens right at the corners of the mouth. The lack of essential tissue iron-containing enzymes causes angular stomatitis, or cheilitis, which is this painful fissuring and ulceration right at the edges of the lips. Patients might also experience a painless inflamed tongue, sudden hair loss, and something truly fascinating called pica. Pica is the development of incredibly unusual dietary cravings for non-food items like dirt, clay, or ice. It's basically your body's confused, desperate attempt to find missing minerals.
Okay, let's move inside your bloodstream to look at the microscopic changes. Let's actually zoom in to see how the blood alters to build into such severe physical symptoms.
At its core, iron deficiency essentially breaks your body's hemoglobin factory. Hemoglobin is the protein in your red blood cells that actually carries the oxygen, and it absolutely requires iron at its center to function. Without iron, you get a defect in hemoglobin synthesis. The resulting red blood cells are pushed out of the bone marrow completely defective. They are hypochromic, which literally translates to undercolored or pale, and microcytic, meaning abnormally small.
This peripheral blood film shows exactly what that looks like in a real patient. A healthy red blood cell should look like a plump, red donut with a small, pale center. But notice the cells here. They are tiny, and they look washed out, almost like empty rings. Scattered among them, you can also see occasional target cells which look like little bullseyes, and pencil-shaped poikilocytes, which are those elongated, stretched-out-looking cells. Your blood is physically changing shape.
Now, the really crucial point here is that this destruction doesn't happen overnight. It happens in distinct, stealthy stages. Step 1. The iron stores in your bone marrow macrophages, your body's emergency reserves, completely empty out. Step 2. This creates a latent iron deficiency. You don't actually have anemia yet, but your tank is totally on empty. And finally, step 3. Without any stores left to draw from, your blood count drops and that pale, hypochromic microcytic anemia fully registers in your bloodstream.
By the time the anemia fully hits and you feel terrible, your medical lab tests will show a severe drop. We measure this through a protein called ferritin, which reflects your tissue iron stores. A normal ferritin level is well above 30, but in iron deficiency anemia, serum ferritin crashes incredibly low, typically below 15 micrograms per liter. On top of that, your transferrin saturation, which measures how much of your iron-carrying protein is actually holding iron, drops under 16%. The tank isn't just low, the supply lines are completely empty.
Which brings us to, Where did the iron go? If our bodies are so incredibly efficient at recycling iron from old red blood cells, we have to ask ourselves, how did we lose it in the first place?
Well, when we look at the major causes in developed countries, it is rarely just a bad diet. The dominant culprits usually involve a leak in the system, specifically chronic blood loss. This often means heavy menstruation or subtle, hidden bleeding from the GI tract due to peptic ulcers, prolonged aspirin use, or even colon cancer. Another massive category is increased demands. During pregnancy, for instance, a mother's body needs a massive 600 extra milligrams of iron just to expand her own red cell mass, plus another 300 milligrams to build the fetus. Finally, conditions like celiac disease can cause malabsorption, where the gut simply refuses to pull iron from the food you eat.
Conversely, flip the script to developing countries, and it's a bit of a different story. Here, a lifelong poor diet consisting mostly of cereals and vegetables, which contain harder-to-absorb iron, is a major baseline factor. But when you combine that poor diet with iron actively lost to internal hemorrhaging from widespread parasites like hookworm or schistosomiasis, and add the metabolic demands of repeated pregnancies, it completely transforms iron deficiency into a devastating, population-wide systemic issue.
All right, let's talk diagnosis and treatment solutions. Once the medical detective work pinpoints the exact underlying cause of the deficiency, how do we successfully reverse it and get the patient's energy back?
Rule number 1, and I absolutely cannot overstate this, you must treat the underlying cause first. If a patient has an undiagnosed bleeding ulcer, undiagnosed celiac disease, or a heavy GI bleed, simply handing them iron pills is literally like pouring water into a leaky bucket. You have to patch the hole before you can refill the tank, otherwise the anemia will just keep coming right back.
To replenish those empty stores, doctors typically prescribe oral iron supplements. But there are very specific rules to this. We usually use ferrous sulfate or ferrous fumarate because they are highly effective. For maximum absorption, they need to be taken on an empty stomach. And here is a super fascinating recent update in hematology. It's actually best given as a once-daily dose. Why? Because taking an iron pill causes a hormone in your body called hepcidin to naturally spike, and hepcidin actively blocks further iron absorption for hours. So taking pills multiple times a day is essentially useless. Finally, you have to continue the therapy for at least 6 months, long after you feel better, just to completely pack those bone marrow emergency stores back full.
So how do we know it's actually working? Doctors look for a very specific metric. If the therapy is working, the patient has stopped bleeding, and the gut is successfully absorbing the pills, the patient's hemoglobin concentration should rapidly rise at a rate of approximately 20 grams per liter every 3 weeks. If it doesn't hit that mark, the doctor knows they either have the wrong diagnosis, the patient isn't taking the pills, or that leaky bucket is still leaking. It's an incredible balancing act keeping our blood fueled and oxygenated, isn't it? Given how stealthily those vital bone marrow iron stores can drain completely to zero before a single physical symptom like fatigue or spoon nails ever appears, you really have to wonder, is your own body's delicate iron balance silently tipping into the red right now? Thank you for checking out this explainer. Keep questioning, keep learning, and we'll see you in the next one.